Hello people, welcome to my channel. I hope you guys are doing great. Thanks for clicking onto this video. In this video, we're going to be discussing everything to do with GP nurses, practice nurses, and we'll just explore the whole area. So in this video, I really do want to focus on the brief nature of the role, what the role entails, and also what you can expect if you are thinking of moving into this area as a student. Maybe you just want a career change, or maybe you're just curious. So if you've never been to my channel before, I'm the Skin Connoisseur UK. My page is mainly everything to do with dermatology and aesthetics, so do have a look around. You might see something that you like. And also make sure to follow me on my socials as well at the Skin Connoisseur UK. I'm on Instagram and I'm also on TikTok, and subscribe to my channel too for all the good updates on that skin. I'm also a final year nursing student as well, and I did have a recent placement in a GP which has prompted me to make this video. So let's get straight into this video. A GP or practice nurse is a nurse whose primary location is at a GP surgery or practice. Their main aim is to promote the health and well-being of patients in the community setting. So they can do the basic nursing skills such as checking your blood pressure, reviewing medication with you, maybe taking some blood samples that you may need done, urine analysis, etc. So those are the basic nursing skills, and then the more advanced will be your more specialist advanced nurse practitioners who may specialize in respiratory illnesses such as COPD, asthma. There's also diabetic specialist nurses and tissue viability nurses as well, which will also be based at the GP surgery. So what I experienced, your day will start at 8 and typically finish at 6. So once you come in at 8 a.m, you'll be helping out with phone calls. So you know when you call your GP and you want a phone call back, you'll basically be doing that for at least an hour or 2 hours until your clinic begins, and they will basically assist in triaging these patients, giving advice over the phone, and also booking for these patients to come in if they feel that these patients do need to be seen at a face-to-face capacity. Sometimes a GP nurse may be called out to visit a patient in their home as more like a community sort of nursing side, but that's quite rare, and that's often part of a different nursing speciality. That tends to end around 9 a.m, probably 10 a.m the latest. After this time, a nurse will be booked up, so they'll have their own timetable on the computer where usually every 20 minutes they will have a patient that they need to be seeing in a face-to-face capacity. So once your clinic begins, you have like 15 minutes to 20 minute slots, and you'll be seeing your patients often back to back. Okay, so as the appointments begin, a patient will come into the nurse's room. They'll have a mini consultation and then do the action of care that they feel is appropriate at that time. So for example, if a patient comes in and maybe they're saying that they're struggling to sleep or something like that, the nurse will then prompt questions in this consultation and make clinical decisions as to what needs to be done and what doesn't need to be done. If it's something like diabetes, this patient will come in, they'll have their blood pressure taken, and often they'll do a diabetic review as well, which involves checking of like the feet, checking of the blood sugar, and whether their medication may be working for them. But this does tend to be a bit more specialized. If one of your patients come in and they say they have a stomach ache, they haven't been sleeping well, etc., using your clinical judgment skills, you can then prompt for further questions and also do routine exams that you feel might be useful to help this patient as well. So it is very important that you are aware of your basic nursing skills and also how to support patients in a more independent fashion as well. So this can include maybe asking the patient to lay down, tell you where the pain is, press onto the stomach to see where is hurting. Could it be the appendix? Could it be something else? So these are just things that is important for you to maybe research before going into the profession. But like I said, the support will be there anyway, but it's just something useful for you to know. Being with a patient one-to-one for a certain period of time as well, I think it's easier to get more out of the patient. So when a patient comes in, it's more of a safe environment, and they've got the time to express other concerns. Maybe they're grieving, maybe they've recently lost their job. And from these points, as a nurse, you can then use your skills to refer these patients to well-being, to a doctor, for example. So it's much nicer, and I'm sure it's probably much more nicer for the patients as well. So on this placement, I also had the privilege of working with a TNA, which is a trainee nursing associate, very similar to nurses on the degree program, but a bit more hands-on. So what she did for the majority of her day was take blood pressure for patients. To be a practice nurse, you do need to have completed your nursing degree program or your nursing apprenticeship program, and the structure seems to have changed as well to get into GP nursing, which is quite good. So there was a previous misconception that you needed to have worked on the ward for like an hour for a year. You need to have worked on the ward for at least a year, and then you take those skills and then you can apply to be a practice nurse. But it's completely changed now, so don't let anyone tell you otherwise. If it's something that you feel you could enjoy and you don't enjoy the structure of a ward, then definitely look into it. So basically the whole program has changed. So once you qualify from your degree or apprenticeship program, you can apply for practice nursing. So there are a few different programs that are offered. So there's the newly qualified nursing program, which I believe you go straight into the profession and you develop your skills on the job under the form of a preceptorship. And there's also the SPIN program. I will attach what SPIN stands for because I can't quite remember off the top of my head. But the SPIN program, you work as a practice nurse for 18 months. There's certain proficiencies that you go through and you get ticked off. And at the end of this program, you actually end up getting another qualification. And from having this qualification, you can then choose to specialize in what area of practice nursing that you may want. So this could be your COPD, it could be diabetes, it could be women's health, etc. So there's an array of opportunities to get into practice nursing. So to be a practice nurse, you do need to have your basic nursing skills. So that's knowing how to take vital signs, knowing how to do basic wound care and wound dressings. Also knowing as well how to recognize safeguarding issues as well, which is very important. It's something that you need to know as a nurse. So if your patient is coming in, it's an adult patient, but maybe the child is coming in and their clothes are dirty and they have bruises, you need to question that. So we focus on the patient, but we also focus on other factors as well, which contribute to the patient. I hope that makes sense. So yeah, you have your basic nursing skills. In addition to that, you do injections and you also take bloods as well. The benefits of working as a practice nurse is that you're basically independent. You're under your own accord. You manage your own patients. And that's something that really stood out to me. I don't like the concept of someone breathing down my neck, as I'm sure a lot of you probably don't either. So it's really nice to have that freedom to just manage your patients, organize your diary, and give the best care to them. So of course, you're not entirely alone. You'll have other senior nurses around you that you could ask for help if it ever gets to that point. So there's always support there, but it's more independent working. As a practice nurse, you do work in a multidisciplinary team, and luckily you do tend to all be in the same practice. So if you need to ask pharmacy a question about a specific medication, you can do that. There's doctors around if you need to escalate to a doctor. It is really nice sort of having a team under one building in a quiet, calmer capacity compared to how a hospital may be. So yeah, the support is there, and the team is also around you as well if you have any other further clinical questions. As a practice nurse, of course, we're protecting the holistic well-being of the patient. We're looking at the patient as a whole, and due to having one patient at a time, I experienced it being a bit more manageable and a bit more easier to pick up on cues that you may not be able to pick up in a more busier climate. So for example, your patient comes in, they tell you their problem. As a nurse, you use your nursing skills, your nursing assessment skills, and you basically prompt, you question, you provide a consultation for them, and you use these important lessons that you would have learned from your course on how to basically treat them. Nurses that I worked with, they had allocated admin time as well, which I thought was quite good. So within this time, they could catch up with previous patients, maybe give them their results from their urine sample that they had done at the GP, and also finish off your notes as well from other patients. So it's a lot more independent. Like I said, a lot more calm. You manage your time, you manage your patients. The main issues I saw being presented to the GP, to the practice nurses, were mainly wound care, asthma reviews, diabetic reviews, concerns with COPD, and just general health complaints like headaches, stomach aches, etc. So your aches and pains, also bloods as well. So I didn't see any cannulations, no IVs or anything like that. I don't believe those take places in GPs like at all, but that is something that I guess you probably need to look up if you do want, you know, your full preceptorship. So after working in a GP for a set period of time, you can then choose to specialize if you wish. So this could be in like your diabetes, your COPD, women's health, etc. So there's lots of things that you can specialize in, and that will take you up to like your band 6s and your band 7s. So some of the benefits I saw as a practice nurse was, of course, the flexibility and the own patient management, the independent working. A lot of the practice nurses were actually part-time, so we'll do part-time in the GP and then part-time elsewhere. So if you do enjoy maybe working on the ward, for example, I'm sure you could do part-time ward and part-time GP. So there's a lot of opportunity. The possibilities are endless, literally. Also, working in a GP, I found that you see a lot more conditions that you wouldn't necessarily see in a hospital. So for example, this was my first time learning how to carry out a diabetic foot check. It was my first time knowing how to use certain diabetes medications like the Ozempic, and also the reader patch as well that's inserted into the arm. So things like this you wouldn't necessarily see in a hospital. You see a whole lot more. And I also like the idea of you consulting your patients independently, you know, using your clinical judgment skills by yourself in order to manage the health and well-being of the patients. So that was like really nice. I really enjoy that aspect of it. And of course, although, you know, you're constantly seeing patients, you do get a little bit more of a breathing space. So in a hospital, for example, if you've, you know, seen your patients for the morning, everyone's okay, and you start doing your notes, it's often, can you do this? Can you do that? And like, there's always something. But in a practice, you know, you've basically got your own clinical room, your own space to just actually process what you've seen so that you can write your notes in a much more better way, a calmer way. And yeah, if you need to make a hot drink, you can get a hot drink. If you need to use the loo, you can go and use the loo. Like, it just seems a lot more manageable. So if work-life balance is something that is important to you, this could be an area for you. Overall, I really enjoyed my placement in a GP. I really enjoyed it, and it is something that I may look into in the future, who knows. But I do hope that you found this video useful. It's a brief introduction to practice nursing. So of course, subscribe to my channel, have a look at my socials, follow me on there, and I hope to see you guys soon in another video. Goodbye.